Here is your full YouTube script for Dr. Waterling Hub. Have you ever looked down at your legs and noticed those twisted, bulging veins becoming more visible every year? Maybe you've been told that surgery is your only option, but what if there were steps you could take today that might help reduce discomfort, improve circulation, and support healthier veins naturally? Stay with me, because what you're about to learn could completely change the way you think about varicose veins. Varicose veins affect millions of people, especially adults over 50. They can make your legs feel heavy, tired, swollen, and uncomfortable. For some people, they are mostly a cosmetic concern. For others, they can interfere with daily life and make even simple activities feel exhausting. The good news is that surgery isn't always the first answer. In many cases, lifestyle changes and daily habits can significantly improve symptoms and help prevent varicose veins from getting worse. Today, I'm going to walk you through a simple step-by-step plan that can help support healthier veins without surgery. And the best part is that most of these strategies are easy to start right at home. Before we begin, remember that this content is for educational purposes only and not medical advice. If you have severe symptoms or concerns, always speak with your healthcare provider. Let's start with understanding what varicose veins really are. Inside your veins are tiny valves that work like one-way doors. Their job is to help blood travel back toward your heart. Over time, these valves can weaken. When that happens, blood may begin to pool in the veins instead of moving efficiently upward. Think of it like a traffic jam. The blood gets stuck, pressure builds, and the veins begin to stretch and enlarge. That's when those familiar blue or purple twisted veins start appearing. Many people assume this process is simply part of aging and that nothing can be done. But that's not entirely true. The first step in our plan is movement. One of the worst things for circulation is staying in the same position for long periods. Whether you're sitting at a desk, watching television, or standing in one place for hours, blood can begin to pool in your legs. Your calf muscles act like a second heart. Every time you walk, those muscles squeeze the veins and help push blood back upward. That's why walking is one of the most effective exercises for people with varicose veins. You don't need intense workouts. Start with a simple 20 to 30-minute walk each day. Even breaking it into shorter sessions throughout the day can help. Imagine two people. One spends most of the day sitting. The other takes 3 10-minute walks throughout the day. Over time, the second person's circulation is likely to be much better. Movement is medicine when it comes to vein health. The second step is elevate your legs. This may sound too simple to work, but it can make a noticeable difference. Gravity is constantly pulling blood downward. When you elevate your legs above heart level for about 15 to 20 minutes, you're giving your veins a helping hand. Many people report that their legs feel lighter and less swollen afterward. Try placing a few pillows under your legs while lying down. Some people like to do this while reading, watching television, or relaxing in the evening. Think of it as giving your veins a daily vacation from fighting gravity. The third step is maintain a healthy body weight. Extra body weight creates additional pressure on your veins, especially those in the legs. Imagine carrying a heavy backpack all day long. Eventually, your body begins to feel the strain. The same thing can happen to your veins. Even modest weight loss can reduce pressure and improve circulation. You don't need extreme diets or complicated programs. Focus on eating more whole foods, vegetables, fruits, lean proteins, and healthy fats while reducing highly processed foods whenever possible. Small changes performed consistently often produce the biggest results. Now here's something many people overlook. Hydration. Your veins function best when your body is properly hydrated. When you don't drink enough water, circulation may become less efficient. Start paying attention to your daily water intake. A simple habit, like carrying a water bottle throughout the day, can help remind you to stay hydrated. Many people are surprised at how much better they feel when they consistently drink enough water. Let's move on to step 5, and this one is incredibly important. Compression socks. Some people avoid them because they think they're uncomfortable or only for elderly individuals. But compression socks are one of the most commonly recommended non-surgical tools for managing varicose veins. These specialized socks apply gentle pressure to the legs, helping blood move upward more effectively. Think of them as extra support for your veins. Many people notice reduced swelling, less fatigue, and improved comfort after wearing them regularly. If you've never tried compression socks before, talk with your healthcare provider about which type may be appropriate for you. Now, before we continue, if you're finding this information helpful, make sure to subscribe to Dr. Waterling Hub for more health updates, practical wellness tips, and easy-to-understand information designed to help you stay healthy and active as you age. Let's continue. Step 6 involves avoiding long periods of sitting or standing. This is especially important if your job requires you to remain in one position. Set a reminder every 30 to 60 minutes. If you're sitting, stand up and walk around. If you're standing, try shifting positions, walking briefly, or performing calf raises. These small movements can significantly improve circulation over the course of a day. The 7th step may surprise you. Pay attention to your clothing. Tight clothing around the waist, hips, or upper legs can sometimes restrict healthy blood flow. Choose comfortable clothing that allows normal circulation. Your veins work hard enough already. They don't need additional pressure from overly restrictive garments. Now let's talk about food. Certain foods may support circulation and vascular health. Colorful fruits and vegetables are rich in antioxidants that help protect blood vessels. Foods containing fiber may also be beneficial because constipation can increase pressure within the veins. Consider adding foods like berries, oranges, leafy greens, carrots, beans, oats, and whole grains to your routine. These foods support overall cardiovascular health and may contribute to healthier circulation. Another important step is reducing excessive sodium intake. Too much salt can contribute to fluid retention. When your body retains excess fluid, swelling in the legs may become worse. Start checking food labels. Many packaged foods contain surprisingly high amounts of sodium. Cooking more meals at home gives you greater control over what goes into your body. Let's discuss one habit that often gets ignored: foot and ankle exercises. Simple movements can stimulate circulation even when you're seated. Try pointing your toes upward and downward. Rotate your ankles in circles. Perform gentle calf contractions. These exercises take only a minute or two, but can help keep blood moving. If you travel frequently by car or airplane, these movements become even more important. Now here's another key step. Protect your veins from excessive heat. Very hot baths, prolonged hot tub use, and extended exposure to high temperatures can sometimes cause veins to expand. While warmth may feel relaxing, excessive heat can make symptoms worse for some individuals. Moderation is important. Another habit worth developing is sleeping with slightly elevated legs. Some people place a pillow under their lower legs during sleep. This gentle elevation may support circulation throughout the night. It won't produce overnight miracles, but over weeks and months, small habits often add up. And that's really the secret here. Many people look for a single magical solution, but vein health usually improves through a combination of daily actions: walking, hydration, healthy eating, compression support, leg elevation, regular movement. These habits work together. Think of it like maintaining a garden. You don't water a plant once and expect it to thrive forever. You care for it consistently. Your veins are no different. Now let's talk briefly about expectations. Can varicose veins disappear completely without surgery? In some cases, existing enlarged veins may not completely vanish. However, many people experience reduced swelling, less discomfort, improved appearance, and better overall leg health when they follow these strategies consistently. The goal isn't perfection. The goal is healthier circulation, greater comfort, and slowing progression. And that's a meaningful achievement. It's also important to know when professional medical care is needed. If you experience severe pain, skin changes, ulcers, significant swelling, bleeding veins, or sudden symptoms, seek medical attention promptly. There are situations where medical treatments are necessary and highly effective. Never ignore serious symptoms. But for many individuals, these daily habits provide an excellent foundation for managing varicose veins naturally. Imagine yourself 6 months from now, walking more comfortably, feeling less heaviness in your legs, experiencing less swelling at the end of the day, having more confidence in your mobility and health. Those improvements often begin with the small choices you make today. Health is rarely built through dramatic actions. It's built through consistent daily habits. One walk, one healthy meal, one glass of water, one decision to move instead of sit. These choices may seem small in the moment, but together they can create powerful results over time. And that's the step-by-step plan. Simple, practical, natural, and something you can begin implementing immediately. If you found this video valuable, make sure to subscribe to Dr. Waterling Hub and turn on notifications so you never miss our latest health updates. Remember, your veins have been supporting you every single day for decades. They deserve a little support in return. Take care of your circulation, stay active, stay informed, and most importantly, keep investing in your health one day at a time. Thank you for watching, and I'll see you in the next video.